Across the U.S., there are about 775,000 active physicians. About a third of those run their own practice either solo or with a partner, a number in decline as doctors find it increasingly difficult to practice medicine while managing the needs of a small business. Dr. Mona Mongit opened her St. Petersburg practice in March of 2007, 7 years after graduating medical school. Even with the help of a mentor, the learning curve was steep, taking a year to set up. It was a real-life crash course on how to run a business.
We are woefully undertrained on how to actually practice the business of medicine. We know how to practice medicine, how to make people better and care for people. I wish I had a communications degree. I wish I had a public health policy degree. I wish I was a lawyer. I wish I was an accountant because I don't know how to keep up with all these.
Dr. Jay Wolfson is the Associate Vice President for Health Law, Policy, and Safety at the University of South Florida's College of Public Health. He's an expert on where healthcare and business intersect.
Look at the paperwork that physicians' offices have got to go through right now, and so many of my colleagues say, I never went into medicine to be a bureaucrat, to process papers, to deal with insurance companies. I went into medicine to see patients and help people. But at every turn, I'm told by this insurance company or by this Medicare entity that I can't do this, that I have to do that I have to file this paper. It gets very frustrating.
Physicians feel powerless. They feel like they're being trampled in this whole process.
Do you, as a small business owner, do you feel your nemesis in this game is the health insurance companies or the government or both?
I feel it's the health insurance companies. I feel like I'm fighting them. They're my enemies. Unfortunately, whereas I feel that they should be my partners because we're both trying to do supposedly the same thing for our patients, but it feels like I have to fight the insurance companies to do what I need to do for my patients.
Why are they not paying? Why does it take several attempts to get a reimbursement?
Well, it's clear to me because they're in this for a different reason. They're in this to make money. And in their model, the way they make money is that they insure a lot of people, and hopefully each one of those people they insure will never get sick, and they'll never have to pay money on them, but they can continue to collect that premium. So in their model, I understand that's how they make money. That's their goal, is to not pay out on claims and to hold that money and make profit. And that's where the problem comes in.
While it may be easy to demonize the insurance industry, it's worthwhile to note that insurance profits are relatively low. A drug company keeps about 18% of its sales in profits, a biotech firm 27%, but an insurance company 4%. Dr. Scott Latimer is a former primary care physician who's now an executive in the insurance industry in Tampa.
Sometimes it has to do with how the claim was submitted. Health plans have certain requirements for data that come in on the claim. If there's a problem with that, it can cause a claim not to pay correctly. Sometimes there's simply rules about certain services that are reimbursed and certain services that aren't. A lot of times it's education to make sure that the doctor's business office or the doctor themselves know how that particular contract works and how to correctly submit a claim. Things can go wrong.
Oftentimes it feels like insurance companies will just deny your claims just to kind of wear you down. Just so that, eventually you might stop, you might give up trying to get paid on those claims. And there's also a timely file. So if you don't get on the ball and get them what they want and fix those T's and those I's, like in 6 months, that's it. You lost your chance. So it's sort of like, it's a game we play every day.
The doctors look at this as possibly the health plan wants to hold on to the money. They'll resubmit the claim, the health plan will process it, and each time that occurs, it actually costs money. So from a health plan perspective, to pay an appropriate claim correctly the first time is actually the most cost-effective way to process that interaction.
It takes hours, sometimes days and weeks of fighting, and physicians don't have that time. That's why they can only spend 5 or 7 minutes with each patient, not because they want to do something else. Many of them don't take time for lunch, because the insurance reimbursements, the Medicare reimbursements, the managed care reimbursements have gotten so low, and the bureaucratic requirements for office management are so huge.
I'm not sure what the future holds. There's going to be a lot of change, obviously. I hope that the private practice model will be able to be a sustainable model as we go forward, but I'm not sure.